Now, in Italy, plans to relax restrictions have been outlined. The Prime Minister, Giuseppe Conte, said measures would be eased from May the 4th, some 7 weeks after they were imposed to curb the outbreak. Sally Lockwood reports now from Rome.
Well into a 7th week in one of Europe's strictest lockdowns, just days from a third deadline, Italians are finally hearing what lies ahead. Factories will reopen from the 4th of May. 2 weeks later, retail stores. But bars, restaurants and hairdressers, it'll be the beginning of June. Bookshops have been one of the very few things allowed to reopen already, but it's made little difference economically, with people still largely confined to their homes.
Possono passare, prendere il libro e andare via, quindi siamo un po' mozzati.
Avete perso tanto business in questi?
Sì, abbiamo perso molto.
A paragone dell'anno scorso, come si può paragonare?
Il 60-70% abbiamo perso. Quindi sì.
Some businesses have struggled so much, they simply won't reopen again. In regions like Veneto, they're relaxing a few measures sooner, allowing people to exercise more and have family gatherings for the national holidays. Veneto had a similar early outbreak to its northern neighbour Lombardy, but tested far more extensively and averted the same crisis.
The government is looking to roll out both tests for the virus and antibody tests nationally as it looks to loosen lockdown. But there's great disparity from region to region. For instance, 3 weeks ago, healthcare workers at greater exposure were guaranteed tests for COVID-19. But it's up to local health authorities who's at risk and how the tests are done. So some medics are paying for them privately.
We visited a clinic in Lazio now offering private antibody tests. A quick blood sample identifies who may have already been exposed to COVID-19, but the majority of people paying for the tests here are doctors.
Soprattutto medici. Per I medici 70 euro, per le persone 100. La risposta in giornata.
Anche lei ha praticato?
No, io ancora no, però fra un po' lo farò pure io.
They're about to run out of tests here. Orders for more are on hold. The scale of this pandemic means demand for everything is the greatest challenge. Italians seem to understand life can't return to normal anytime soon. But now at least, the endless horizon of lockdown is slowly lifting. Sally Lockwood, Sky News, Rome.
Just a line coming through from the Betting and Gaming Council. This concerns, reports, I suspect, showing that there's been more online gaming during the course of the lockdown. The UK's largest gambling firms will remove all TV and radio advertising for games and products during the coronavirus lockdown, so says the Betting and Gaming Council in the last few minutes. Well, the government's deadline for reaching its daily target of 100,000 tests is this coming Thursday. At the moment, fewer than 30,000 tests are being carried out each day. A scientific advisor for the government has said the target must be met to help the country emerge from quarantine by tracking and tracing cases of COVID-19. Well, joining us from Worcester today is Brian McCloskey, former Director of Global Health for Public Health England. Brian McCloskey, welcome to you. I wonder if we can start with with what the Prime Minister, who's now seemingly back to full working order, had to say around about 9 o'clock this morning in Downing Street. He stressed the absolute vitality and the vital importance of the country not prematurely emerging from lockdown, lest we're then hit by second and subsequent waves.
I think that's absolutely right. We are seeing some promising signs that we are getting on top of this and the curve's flattening, but we must absolutely not do it too quickly because we need to be very careful, do it in a very staged way, very slowly and a very good planned way.
You can understand, can't you, though, voices coming not just from business, but other areas as well, and in fact the evidence of our own eyes, which is that there are more people now taking their own destiny into their own hands. They're making journeys they wouldn't perhaps have made a couple of weeks ago. Things are changing organically almost.
I think that's right, and it's quite worrying in some ways because if we do it too soon, if we don't do it in a very planned and organised way, then we are putting people at risk again and we could go backwards. And if we go backwards, it'll be even harder to get back to where we are now.
It's been likened to applying a plaster and actually putting it on the second time is much, and the third time is much harder than putting it on the first time. In my introduction, I mentioned the testing target. I mean, setting aside the politics of that and how shrewd or otherwise it was to set a target that you may then struggle to meet. Remind us if you can, I know we've talked about this and laboured this point greatly, but the testing regime is what really will matter in some respects.
Absolutely, but we need to be clear, it's not testing for the sake of the individual, if you like. It's testing to make sure that as cases happen after the lockdowns ease, we identify everyone, we test them, and we follow up all their contacts to make sure they don't spread it to anyone else. So that sort of testing program has to be in place before we start easing restrictions. It also has to have all the public health capacity behind it that will allow Public Health England and local authorities to do all that contact tracing.
I think just on the Thursday target of 100,000, by the way, the government's saying that they simply won't have the data in because of the lagging effect. We won't know actually whether this target of 100,000 has been met, which I suppose is politically embarrassing, but practically doesn't make a lot of difference, does it? Can we talk about another area that continues to be an area of some disagreement, really, on masks? I mean, I think the Germans today, or the Italians, are saying if you want to go into a shop, you have to have one. If you're going on public transport in another European country, you need to wear a mask. What's your thinking on this? Has it shifted?
No, I mean, we have to be clear why people wear masks. If you wear a mask in public to try and stop yourself getting infected, that simply doesn't work. If you're wearing it because you don't want to spread infection to other people, there is slightly more evidence for that. But actually, if you have symptoms, then you shouldn't be out in the first place and you shouldn't need a mask. So I would still say wearing masks in public is not a priority. Masks for carers, for people that are ill, people with symptoms, yes. But for the general public, it's still not a priority.
As we look at the data as it comes in, is anything striking you as wholly unexpected in this? I mean, I say that because one thing that we're all learning quickly about is that sense in which epidemiology isn't an exact science. It's perhaps a little more akin to economics than physics. There are no definitive answers here. There are very educated guesses, but they remain guesses.
And I think that will be the case for a while. The problem is that some of the systems that we're trying to use, particularly for counting deaths, while it seems obvious that we can count deaths easily, actually the system is set up to record the fact of death so that people can go and have a funeral, a wake, a burial, etc. It's not set up particularly well to record the cause of death quickly. And that's what people are struggling with, to get that information from community, from care homes, from hospitals, all in the same package at the same time. And it's actually much more difficult than people might think it is.
Yeah, well, we're learning that, aren't we? Brian McCloskey, good to talk to you. I appreciate your time. Thanks a lot.
Thank you.
Well, on his first day back in the job, just mentioned a moment ago, the Prime Minister has told Britons to be patient and said lockdown measures won't be eased, at least not for a bit. The Prime Minister said relaxing restrictions could lead to a second or subsequent waves of the virus, and that would put the economy at ultimately even greater risk. Well, the Conservative MP, Richard Fuller, is a member of the House of Commons Business Select Committee, has called on the Treasury to publish its economic assessment of the lockdown. He joins us now, as you see. Richard Fuller, welcome to you. Why do you want to see this published? Why do we need more transparency from the Treasury, do you think?
Well, I think because, the government's got no shortage of good advice and ideas from people about the intricacies of how to do the release from a lockdown. But I think that misses the most important thing, which is the consent of the people about that. And we went into lockdown with quite a lot of consent because we all had a shared experience, which was we were scared, frankly, about what the virus might do and how it might affect ourselves and our loved ones. But as we come out of the lockdown, different groups of people will have very different experiences. And I think the Prime Minister should be looking to get a level set amongst everyone. And one of the ways of doing that is by sharing some of the very real consequences this is going to have for our economy.
We don't know what Rishi Sunak, the Chancellor, is going to say later on in the Commons this afternoon. We imagine he's not going to be doing what you want him to do, which is to publish that type of assessment. But he may be able to offer a roadmap of sorts, suggesting which sectors perhaps might see a gentle easing. What would you urge him to do?
Well, I think clarity is the one thing that businesses would like to see so that they can start to plan for how they're going to deal with a very difficult economic circumstances that many businesses are going to face. You're going to have some businesses already who haven't received the support of being missed despite the best efforts of government. We've got many freelancers across my constituency and across the country who haven't been covered by programs, many very small businesses that perhaps were looking at each month's cash flow to keep their business going, who will be uncertain about their future. And you'll have companies that will be looking at what their future cash flow will be when business starts to come back, not expecting a fast ramp up back in demand. And so I think if Mr. Sunak, when he is ready, can provide clarity of dates, even if it's saying to people in the hospitality industry that it's end of September, that enables business leaders and their boards to do their budgeting and do their planning.
Sure, I mean, you can see why he might be able to help you with the what, but helping those businesses with the when, I mean, that's incredibly tricky, isn't it? Because, you know, we were just talking with our previous guest about the nature of epidemiology. It's not an exact science, and you have to be guided by the science in this.
Well, you do, but we live in a, if I can make a slightly pun phrase, we live in a democracy rather than a dococracy, and at some point, the medical advice has to be balanced by other factors that affect people's livelihoods. And as many, I'm sure people you've had on your program will have said, that economic recessions do create and have their own costs in terms of human well-being and human lives. I do think that the timing for businesses is the right thing. People can do what the Prime Minister has asked us to do today, which is to bear with this whilst we defeat it a little longer. But by providing that clarity on dates, it will enable some important aspects of business planning to take part. The Chancellor could also perhaps talk a little bit about how he sees companies, the government transitioning businesses and people off some of the support programs. He's moved, for example, the furlough program to the end of June, but what would likely happen after that? So he could perhaps help with that planning process by giving some more specifics on some of those programs.
I think most people understand the connection, the link there exists between the tax base and ultimately the wealth that's created that then funds the NHS. Perhaps what they're less certain about is whether ultimately that tax base may be permanently reduced to some degree, whether there is irreparable damage that's going to be caused to some hitherto successful tax contributing businesses, which we will simply not get back. And that will be to the permanent damage of our income stream for the NHS. Can we demonstrate that?
I think it's evident in the evidence is there every single day. You're seeing that in terms of increased government borrowing, I think quadrupling over the next 3 months. We've got forecasts for the biggest reduction in consumer confidence that we have ever seen, and we have predictions for very significant levels of unemployment. The issue is that people who perhaps are at home, not working at the moment, but receiving government support, that information seems very far away from their day-to-day lived reality. And at some point, their experience will have to translate to what it's going to mean for their job in the future. And I think the Chancellor and the Prime Minister can play a very important role in explaining that to people so that you get that important consent to the next stage of releasing the lockdown. It's all very well, as I've said, for people to give their ideas for how it should happen. But I think the two things that the Prime Minister and the Chancellor could focus on is ensuring there's consent by being clear on what the economic costs are that are being encountered in the economy, and then very clear with timing for business. So if it is going to be September or is going to be June, at least businesses know it's that date and they can start to plan. And one final point, if I may, Ms. Fraser, is grey areas. Police authorities across the country have been managing the lockdown period, and I think in general very, very well, because people have generally followed the rules, but also the rules have been clear. With a lot of the guidance that may come up for the transition, social distancing in the workplace, for example, there'll be many more areas of grey. And I think the more clarity about that, the less grey that can be provided, I think that'll give a lot more support for the transition phase as well.
Richard Fuller, appreciate your time. Thanks a lot.
Thank you.
The Royal Mint is set to make nearly 2 million medical visors for NHS staff in England and Wales. The organisation, which is better known for making coins, obviously, has transformed its visitor attraction into an emergency production line. Sky's Becky Johnson is in South Wales for us this afternoon. Becky.
Yeah, here at the Royal Mint, they're more used to making money than medical equipment, but they've got a production line together very, very quickly. And if you take a look behind me here, you can see that they're making the visors that are very much needed by the medics on the front line in hospitals. Now, just across the road from the Royal Mint is the Royal Glamorgan Hospital here in South Wales. And the team here worked very closely with medics and the directors at the hospital to come up with a design that worked for those medics. And they've got it into production so quickly. They only came up with a prototype a couple of weeks ago. It's already being made. They're doing around 14,000 a day. When they began, they were making one every 40 seconds or so. They've got that down to one every 6 seconds. So a very well-oiled machine here. There's around 200 staff working round the clock. The operation is 24 hours a day, 7 days a week. Some of them are Royal Mint staff, others are people they've recruited locally. And it all came about because the operations director here set his team the task of designing a mask. Of course, these are people who are used to making things, and he wanted them to use those skills to come up with something to help the NHS, and he explained to me why.
Going back a few weeks ago now, I was having a conversation with my sister, and she's a midwife in the NHS. Several members of my family are in the NHS, and obviously there's a huge demand for PPE, and we talked about visors. So I came in the next day, and we kind of give the engineers a challenge, and we said to them, look, can you produce a visor for us, a prototype we could take over to the hospital, which is only 200 yards away, within the next 24 hours, and they did it in 8. We then got it approved, went through BSI, got all those things approved and started to ramp up the production you can see here today.
So the orders now come in here for 2 million of these visors to be delivered to the NHS. It means they're going to be working on them for months, but look, they say it's vitally important work that they're determined to carry out. We know that one of the 5 tests the government have said will be applied to easing the lockdown is ensuring that there's enough personal protective equipment to ensure the NHS can cope in the long term. So there is that need for the supply, and of course we have heard from so many medics on the front line about the shortages and the difficulties in getting the kit to people who need it, which is why they say here they're so determined to help in that national effort.
Becky, thanks. This is Sky News Today coming up. A campaign to keep us active during the lockdown.
To ensure the NHS can cope in the long term. So there is that need.
Well, Britons have been locked down for 5 weeks now, while team sports and virtual gym sessions are off, or actual gym sessions are off, I should say. Sport England has launched a campaign to encourage people to keep active at home. The slogan is "Stay in, work out." It's the Join the Movement campaign. It features creative ways to keep fit without specialist equipment. This is part of it. Well, let's turn to Tim Hollingsworth, the Chief Executive of Sport England, who joins us now. Tim, a warm welcome to you. Why the need for this campaign?
Good afternoon. Well, hopefully you saw there, I think more than anything else, we want to show people that being active during this current period is possible, no matter what your circumstances, no matter what your ability, or indeed the amount of space you might have access to. But the point of it is much more profound than that, is that being physically active is really brilliant for not only your physical well-being, but for your mental well-being as well. And I think we all should be thinking about that very clearly at this time. And we know that lots of people are, but also we're conscious that there are many people who perhaps aren't finding it as easy to be active as they could do. And maybe this campaign can help them think about what could work for them, because the most important thing is people find something that can help them to be more active at this time.
Yeah, I was talking to a friend of mine, actually, who, in lieu of not being able to go to the gym, has ordered a home treadmill. And actually it was only, I mean, I say only, I thought it was far more expensive, £200 for a treadmill. He was using it, other members of the family were using it. Can't tell you how useful it was or otherwise. But there are many people for whom £200 stretches the household budget to breaking point. So this is where this campaign comes in. You can make do with everyday objects.
Well, you've made actually quite an interesting point there, because we want the whole nation to stay active. But one of the things this lockdown is further demonstrating is the potential for an economic divide in all of this. You're absolutely right. And in some ways also, there are some areas of the country where it's a lot easier under the very strict guidelines that are in place to get out and be active for an hour outside as well, whether that's a run, a walk or a cycle, and that's great. But for a lot of people, that isn't necessarily so easy or so possible. So what we want to show with this film and this campaign, and I think you just showed it now, is that it is possible to do things in a way that can be creative, sure, but can absolutely fit in with everyday life, can fit in with being at home. As you said, the hashtag for the campaign is "Stay in, work out." Anyone goes there and searches for that on social media, they will find a huge amount of opportunities and a huge amount of ideas for how being active doesn't have to mean spending 200 quid on a treadmill.
Does Sport England, Tim, have any qualms about the direction of government policy on lockdown? I mean, for instance, you know, a lot's been written about people driving to somewhere they might ordinarily take some exercise, whether a park or playing fields or whatever. I see there's a report today suggesting that part of the eventual sort of business unwinding might be to look at gyms, how they're used with social distancing on treadmills and all the rest of it. Are you comfortable with the direction of government policy so far?
Oh, I think we've got to accept that the most important thing here from the outset is that we do this within the confines of the government guidelines, and absolutely the understanding of why the lockdown is in place. You mentioned it's been 5 weeks now. I think from day one, wouldn't dream of thinking that this is something that should be different to where it is, if that's the advice and that's the government's perspective. I think our challenge is to make sure that people don't see it as a reason not to be active, and indeed feel that activity can be for them, even when we are in this state of quite restricted activity. So really it's not about whether or not, of course, we, like every other sector, will be looking forward to the day when the restrictions are eased and when we can think again about the really important benefit that community sport and grassroots sports brings to people's lives, the way that clubs, particularly in their local communities, play a really important role. But that's not to prejudge the much bigger picture here about saving lives, saving the NHS. So
Tim,
rather,
leave it there. Tim Hollingsworth is Chief Executive of Sport England. Tim, thanks a lot. Cheers. More news coming up.
Restrictions are eased, and when we can think again about the really important benefit that community sport and grassroots sport brings to people's lives, the way that clubs, particularly in their local communities, play a really important role. But that's not to prejudge the much bigger picture here about saving lives, saving the NHS. So rather,
leave it there. Tim Hollingsworth is Chief Executive of Sport England. Tim, thanks a lot. Cheers. More news coming up. This is Sky News Today. It's 3 o'clock. These are our headlines. Back to work for Boris Johnson. He tells the nation the tide is turning on COVID-19, but the lockdown will stay in place.
I ask you to contain your impatience because I believe we are coming now to the end of the first phase of this conflict.
COVID-19 deaths in England rise by 329. There's been a further 13 fatalities reported in Scotland. We are bleeding cash, the boss of Airbus on the hit they're taking, with thousands told to brace for job cuts. Quarantine eased in Italy after the country reported its fewest daily deaths since mid-March. Formula One plans to start its delayed 2020 season, but fans won't be able to attend. A baby and a 3-year-old boy stabbed to death at a house in East London. Good afternoon, welcome to Sky News Today. The UK is beginning to turn the tide in the fight against the coronavirus, but lockdown measures will not be relaxed. That's the message from Boris Johnson, who returned to work today after recovering from COVID-19, the illness caused by the virus. It comes as Britain enters its 5th week in lockdown and growing pressure for an exit strategy over concern about the damage being caused to the economy.
This is the moment of opportunity. This is the moment when we can press home our advantage. It is also the moment of maximum risk, because I know there will be many people looking now at our apparent success and beginning to wonder whether now is the time to go easy on those social distancing measures. And so I know it is tough, and I want to get this economy moving as fast as I can, but I refuse to throw away all the effort and the sacrifice of the British people and to risk a second major outbreak and huge loss of life and the overwhelming of the NHS. And I ask you to contain your impatience because I believe we are coming now to the end of the first phase of this conflict. And in spite of all the suffering, we have so nearly succeeded. And so when we're sure that this first phase is over and that we're meeting our 5 tests, deaths falling, NHS protected, rate of infection down, really sorting out the challenges of testing and PPE, avoiding a second peak, then that will be the time to move on to the second phase.
Well, the Prime Minister's returned. These are some of the key dates that have affected his movements over the last 5 weeks. Let's take you through them. Boris Johnson had been fronting the government's daily press conference. On Monday, the 23rd of March, he announced that UK-wide lockdown. On Friday, the 27th of March, he tested positive for COVID-19. At that point, went into isolation in a flat above Downing Street. In isolation, his condition deteriorated. He was admitted to St Thomas's Hospital in Westminster on Sunday, April the 5th. A day later, he was then moved into intensive care. But things improved. On April the 12th, he was discharged from hospital, travelled to Chequers, Prime Minister's country residence, to continue his recovery. 4 days later, the Foreign Secretary and First Secretary of State, Dominic Raab, announced the lockdown would persist for at least another 3 weeks. Boris Johnson returned to Downing Street last night ahead of the May the 7th deadline when the government must review the current lockdown restrictions. Let's turn to our chief political correspondent, John Craig, now. John, welcome to you. When the Prime Minister talked this morning, he likened the struggle against coronavirus as a nasty fight with a mugger.
Yes, he did. It was only a fairly brief reference to his own plight over the last few weeks. The message, as we've just heard, was all about this is not the time to relax any of the rules, or he said, I ask you to contain your impatience, as we've just heard. But that we do expect some tweaking, some more nuanced approach in that second phase that we expect to come over the next week or so. But this was how the Prime Minister talked about his own fight with the virus.
If this virus were a physical assailant, an unexpected and invisible mugger, which I can tell you from personal experience it is, then this is the moment when we have begun together to wrestle it to the floor.
wrestle it to the floor. We've had a sort of a wrestling analogy there from the Prime Minister. We've had all sorts of words like battle and fight and so on used in recent weeks, but the fact is the government is battling with a crisis. In the Prime Minister's in-tray are issues like the testing target set by Matt Hancock, the Health Secretary of 100,000 by Thursday, the 30th of April. Obviously, the big issue is the lockdown. The Prime Minister has urged us all to be patient, but there are growing signs that a lot of Conservative MPs are growing impatient. We're going to hear in the next half hour from Rishi Sunak, the Chancellor, who, of course, is under enormous pressure to try and get the economy moving again because of the crippling effect of coronavirus. I think one of the things we might hear from him is a move to speed up some of the payments, compensation payments to self-employed people. There's been criticism they're not going to get those till June. But Tory backbenchers are restless, many of them, although supporters like Ian Duncan-Smith broadly support the government's actions. Mr Duncan-Smith told Sky News a short time ago, essentially, he wants the government to be a bit more candid with the public about the next steps.
The public is looking now to understand how are we going to emerge from this? How will their businesses be set up? How will, their jobs be protected? Where will their incomes come from? All of these things are beginning to enter people's minds because they know that they've done what they can and will continue to do that, by the way, but they want to know what's coming next. And so I think this is a phase where we need to be much more open. We need to, as I said earlier, bring them into our confidence, into the government's confidence. Explain to them, don't treat them like children. Let them know they're adults, they can deal with this, they know that we're not there yet, but they do know that something is changing.
Don't treat the public like children, says Ian Duncan-Smith, and that's from a supporter of the Prime Minister. So we are likely to hear I think the thing to look for when Mr Sunak gets up in the Commons is the reaction to the business pressures from Conservative backbenchers. On that point about openness, transparency, being more candid, treating the public like adults, the Prime Minister did say this morning that he was going to be more transparent, which suggests that the government is prepared to bow to pressure to publish the results, the minutes and the deliberations of the SAGE Committee of Scientific Advisers. Remember, there's been a row over Dominic Cummings, the Prime Minister's advisor, turning up to some of those meetings. Well, it sounds as though the Prime Minister is prepared to bow to pressure and publish the advice from the scientists.
Thanks very much indeed. Well, the data on hospital admissions and indeed fatalities from coronavirus from the different nations of the UK is now in. Let's turn to our health correspondent, Ashish Joshi, to reflect on what may be promising news, Ashish, but obviously there may be a weekend lag effect. We're not sure.
Those things, the weekend lag is certainly there. It's been there all the way from the beginning of this pandemic. We've noticed that when these figures are put together, the Monday when they're presented, there is always a delay in collecting the accurate data from across all 4 countries and then presenting those figures on the Monday. So there is that weekend lag, but also, Colin, I think this is important to emphasize, is that we are seeing some of the smallest rises in the number of people dying since the end of March, and that is very important. And that is why you have the Prime Minister sounding cautiously optimistic. The language here is very, very important because understandably when we talk about the number of people dying, there are still hundreds of grieving families. Each one of those is a tragedy, and that has to be reflected in the way the Prime Minister talks, but also he's trying to give a sense of optimism that we are passing the peak, we are getting through the worst bit of this crisis, but also that doesn't mean that the figures are just going to stop there. They are going to take time to come down from that very high peak, and also when these numbers are presented, you have to understand that these are hospital deaths only, not deaths in the community. So we've had figures for England. We've had another 329 people who have died in England, taking the total number of deaths in the nation's hospitals to 18,749. London was the worst affected area, recording 87 deaths in hospitals from COVID-19. There have been 13 more deaths in Scotland, taking the total there to 1,262. 8 more deaths in Wales, bringing its total to 796, and 294 people have died in Northern Ireland, but the country has yet to update its figures before today. So you can understand why the Prime Minister, when he is surrounded by his team who will look at those figures, look at the trajectories, will start talking about moving towards the end of lockdown. But what he says is absolutely crucially important. There is a real danger of a second wave. If the lockdown restrictions are lifted too soon, all of the work that has gone on for the last 5 or 6 weeks, the sacrifices people have made, will probably be undone, and then we'll be back to exactly where we were at the beginning of this pandemic. So cautious optimism for now.
Ashish, thanks very much indeed. Well, as we often do, try and give you a sense of some of the stories that lie behind the data and the people who have fallen victim to coronavirus. Of those patients who died in hospitals and care homes, the eldest was 108, while the youngest was 5. They include Dawn Marshall, who died from complications caused by COVID-19. She worked as a support worker at the Quayside House in Oldbury, the West Midlands, while Black Country Healthcare said she'd been a valued member of their organisation for the best part of a decade. General practitioner Dr. Yusuf Patel was a partner and founder of the Woodgrange NHS medical practice in Forest Gate in East London. He died last Monday. He was 61. His children described him as one of the most compassionate, loving and fun human beings that you could ever know. Esther Akinsanya was a nurse at the Queen Elizabeth Hospital in Woolwich in South East London. The mother of 2 had worked for the NHS for more than 20 years. Her sister Mary, also an NHS nurse, is currently in intensive care with COVID-19. Now, the chief executive of the European plane maker Airbus has written to tens of thousands of employees, telling them to brace for job cuts. The company cut aircraft production rates by around a third earlier this month after the virus outbreak caused airlines to ground the majority of their fleets. Well, in the letter, the chief executive said the survival of Airbus is in question if we don't act now. He went on to warn workers, in just a couple of weeks, we've lost roughly 1/3 of our business, and frankly, that's not even the worst case scenario that we could face. Well, Airbus employs in excess of 100,000 people, 134,000 people across its entire operation. Of that workforce, 13,500 employed in the UK itself. The wings for all Airbus aircraft made at a factory in Broughton, near Chester, 6,000 people employed at that site alone. Let's turn to our Europe correspondent, Anne Parsons, again, who joins us from Brussels. Adam, these are big numbers.
Well, Airbus employs very, very big numbers on behalf of a very big company, one that spans across Europe. That is what makes Airbus so extraordinary, is that it is a collaboration of European countries, including, of course, the UK. 10% of the workforce is based at those 2 locations in the United